Thank you very much, Prof. Chen. Been a pleasure to be invited to share a little bit about our experience in Singapore. So I thought I would start off very quickly by mentioning what happened in Singapore, because it was one of the first few countries in the world that actually experienced COVID-19. Our first case actually happened in January of 2020. And you could see that over the timeline, since January last year, we have seen a variety of cases coming into Singapore through the borders, through importations, but also the coronavirus spreading in specific communities, such as the migrant workers in Singapore, and now in the community at large within Singapore. So we have experienced quite a lot of pressure on our healthcare system as a result of COVID-19. This became a lot worse from April this year, because what was driving a lot of the infections happening in the community since then was really driven by the Delta variant, which was much more transmissible, as we all know about it now. And I thought it's useful to share a little bit about how Singapore developed our systems, our healthcare systems, to cope with outbreaks, because we had our first run, a dry run of a problem, a pandemic problem such as SARS back in 2003. And it actually helped to shape a lot of our hospital services and response towards outbreaks, to the fact that every year after SARS, we actually have dry runs or military drills of outbreaks happening in all the public hospitals. And this happened in a state that the hospital people are not informed in advance. So from the front desk to the emergency department, to the clinicians and the nurses, they all have to react very quickly when they anticipate that something strange is happening amongst the patient population, that they have to put in place protection to minimize infections in the hospital. And that has actually protected the healthcare workers tremendously, because throughout the pandemic, we continue to see very few cases of hospital infections happening in Singapore. And that has also tied in very nicely with the primary care strengthening that a number of speakers have talked about, that there was a pandemic framework built into primary care in Singapore that was activated the moment COVID-19 appeared to be circulating in the community. And this primary care framework actually formed the front line of our response against COVID-19 in Singapore. And gradually, when we realized that there are going to be a large number of people infected with COVID-19, Singapore started to mobilize the military to establish field hospitals in exhibition halls with a certain degree of clinical care, clinical monitoring, and also the use of new technology such as oximeters to tie in with the science of how would one progress if one is infected with COVID-19, looking at evidence of oxygen distress before quickly moving some of these people back to the hospitals. That actually helped to build in a certain degree of surge capacity in the country throughout the pandemic in the country. But now what we are anticipating in Singapore is a very different situation, because we are starting to adopt a stance of transiting towards living with COVID-19. And living with COVID-19, this process of transiting from pandemic strategies to a COVID-19 endemic strategy was based and grounded in a few realities, harsh realities, that we realized that with the Delta variant, even if we are able to vaccinate all 100% of our population, we know that we will not be able to prevent infections from happening in the community. There will still be a baseline degree of community infections happening. So this concept of herd immunity, as Professor David Heyman has talked about, is no longer relevant, particularly in the face of Delta variants. The fact that COVID-19 is in almost every part of the world means that elimination is no longer viable or realistic. And right now, there are many countries that continue to exert strong control through border controls, through strict restrictions in society, or even through school closures. We know that it comes with a cost. So as countries now start to shift their approach of treating COVID-19 as an endemic disease, what are some of the realities that countries have to face with? Typically, in most countries adopting an endemic COVID roadmap, they rely a lot on vaccination. And we have seen many examples that have been shared tonight around the use of vaccination against a variety of infectious diseases. But what many countries have not realized is that as part of this endemic COVID roadmap, there is a need to prepare the healthcare system for the inevitable surge of patients coming into the hospitals to seek care, because simply relying on the vaccination is not sufficient to protect people from the infection, from some of the severe symptoms, including deaths. And we know that actually when we vaccinate a population, it is the fraction that continues to be unvaccinated that will leverage a significant burden on the healthcare systems. Countries are also putting in vaccine differentiated measures, in part as a form of political coercion to get people who willingly choose to remain unvaccinated to come forward to be vaccinated. But I think one aspect that is very important as part of an endemic COVID roadmap is the need to continue our global surveillance to really understand what is happening worldwide. Are there new variants emerging, and how are these new variants reacting towards the vaccines that we have, towards the therapeutics? The surveillance and the monitoring is just as important for us to do this in our local hospital systems. And I will talk a little bit about this because in Singapore, we've been very privileged and fortunate that we have been able to vaccinate about 84% of our population, and we have started boosting our population. There were concerns about easing up some of the measures that we have in Singapore, but the government started adopting a stance that if we are able to vaccinate a large fraction of our population, we should be in a better state to ease our restrictions. But we started to observe what is happening in the hospitals because we start to see that there is an increase in community infections happening. And in Singapore, we continue to test very aggressively with PCR tests, with rapid antigen tests. In fact, every week before I go to work right now, I have to test myself with a rapid antigen test. And I can only go to work if I present a negative test result to my employers. And we start to see that the variation of case admissions into the ICU as well as of death statistics actually vary considerably according to age and vaccination status, to the point that unvaccinated or partially vaccinated people are more than 10 times more likely than the fully vaccinated people to require hospital care or to experience a death event. And this is where we actually adopt a modeling approach. And I think Professor Srinath Reddy from India has talked about how modeling has not been as effective or as accurate. But actually our experience in Singapore has been that the modeling became extremely vital to guide policy decisions. And so far, we have been very blessed that a lot of our models have turned out to be broadly accurate in predicting whether it is the epidemiology of COVID-19, the surge in case numbers towards the hospitals, the utilization of our hospital resources, and even the number of deaths that we're starting to see in Singapore. It has been quite accurate to guide policy decisions. And that's when we start to monitor and realize that it is extremely important for us to understand our healthcare resources and to prepare in advance that with endemic COVID-19, the vaccinated people, particularly the elderly and those with underlying medical conditions, they will continue to require hospital care if they are infected. The unvaccinated people are much more likely to come into the hospitals because of a severe infection due to their unprotected status. And routinely and daily right now, this is the kind of communications that we're sending to our people in Singapore, that we tell them what is the state of our ICU capacity, that 70% of our ICU is now occupied. So we have a surge capacity of 30% left behind. Is this sufficient or is this insufficient? Because this is going to guide the next step that a country does in relaxing its measures. So for the longest time, Singapore continued to require mask wearing, social distancing, and certain degree of social restriction in place because we were looking at our hospital resources that we need to stretch our epidemiology, the incidence of the disease over a longer period to protect our hospital and healthcare resources. So in summary, I think we benefited from the SARS experience. It was a painful experience during SARS, but it guided us in a lot of our preparation to provide very robust response against COVID-19. The shift from a pandemic approach to an endemic approach will come with a surge in disease burden, regardless of how effective the vaccinations are, as well as the percentage of uptake of the vaccines, to the point that there will be a need for us to prepare the people's mindset, as well as to prepare the healthcare sector for the inevitable surge in hospitalizations and in deaths. And with that, thank you very much again for the invitation, and I look forward to the discussions later on.